Hello, APA students. Mrs. Burgess here again from Las Vegas APA, teaching fourth grade science, lesson number 6 in our respiratory system. I'm going to have you make sure you have your packet in front of you. We don't have a word attack per se, but we are going to create one. I'm going down the left-hand column under condition. We're going to do the common word attack that we normally do, starting with common cold all the way down to lung cancer, and then we'll do our regular response. And then I'm going to bring up a slideshow that's going to help teach you about some of these conditions. So if you would be so kind, please touch common cold touch. First phrase, common cold. What phrase? Yes, common cold. Next word, asthma. What word? Yes, asthma. Next word, laryngitis. What word? Yes, laryngitis. Next word, bronchitis. What word? Yes, bronchitis. Next word, pneumonia. What word? Yes, pneumonia. Next word, emphysema. What word? Yes, emphysema. Last phrase, lung cancer. What phrase? Yes, lung cancer. First phrase, what phrase? Yes, common cold. Next word, what word? Yes, asthma. Next word, what word? Yes, laryngitis. Next word, what word? Yes, bronchitis. Next word, what word? Yes, pneumonia. Next word, what word? Oh, that one's tricky. That word is emphysema. What word? Yes, emphysema. Next phrase or last phrase? What phrase? Yes, lung cancer. Here we go. Top to bottom, bottom to top, and we go. Common cold, asthma, laryngitis, bronchitis, pneumonia, emphysema, lung cancer, emphysema, pneumonia, bronchitis, laryngitis, asthma, common cold. Nicely done, friends. We're going to learn about all of those medical conditions and what you can do to treat or prevent them. So I'm going to share my screen with you. Give me one quick second to get that set up so you can see my slideshow. Okay, and I'm going to come in right here and I'm going to present this. Exit out of that. All right, friends, here we go. So we're talking about the medical conditions that we find with the respiratory system. Remember, that involves our lungs. The first one is the common cold. The first one is the what? Yes, common cold. So the facts about the common cold is the common cold is a viral infection which causes inflammation of the nasal passages. Now, touch your nose, touch. Yes, the passages inside your nose are called nasal passages. So you have a common cold when the passages in your nose become inflamed. This can be prevented, as we're learning very quickly. The first thing you can do to prevent the common cold is wash your hands. The next thing you can do is use Kleenex when you cough or sneeze. Immediately throw that Kleenex away and either wash or sanitize your hands. You can disinfect your stuff. So anything that you touch frequently, your pencils, your desk, your doorknobs, things like that can be wiped down, and we can get rid of most of the virus that causes the common cold. And then, of course, last and most importantly, you need to avoid sick people. So that's our first respiratory condition. Our next respiratory condition is called asthma. Now, this is not preventable. Asthma is a respiratory disease marked by labored breathing, chest constriction, and coughing. Now, because it cannot be prevented, it can only be treated. So what we'd like to recommend is that you follow your doctor's treatment plan if you've been diagnosed with asthma. Try and avoid any asthma triggers that you know you have. Sometimes it's food, sometimes it's conditions like grass, sometimes it's dust, sometimes it's even exercise. And then the last thing you need to do is identify your attack early and treat it quickly. So the faster you get your medicine, the faster you will likely recover from your asthma attack. So our first condition is common cold. Our second condition is asthma. Moving on to the third condition, laryngitis. This happens to me at least once a year. Laryngitis is the inflammation of the larynx or your vocal cords, which causes pain when talking, or it can even cause the loss of your voice. So many of you have either had this or heard somebody who has it where they can barely talk above a whisper. Laryngitis can also be prevented. One of the number one ways you can prevent laryngitis is to not smoke and avoid secondhand smoke. You can also drink plenty of water. Be sure you wash your hands, and you can also rest your voice by not talking or singing, right? No talking, no singing, and definitely no yelling. So our first condition was common cold. Our second condition was asthma. Our third condition is laryngitis. Moving on to our fourth condition, bronchitis. So bronchitis has the word bronch in it, or bronchi. You can actually see bronchi in it. So this is the inflammation of the bronchi, or soreness or heaviness in the chest. Some people also call this a chest cold. It hurts to cough, and sometimes it's hard to breathe when you have bronchitis. Bronchitis can also be prevented. You prevent it by not smoking and avoiding secondhand smoke wherever you can. You need to drink plenty of water. Of course, washing your hands will help prevent it. And be sure that you're getting enough rest, because when your body is tired, it can't fight off viruses as often, or bacterial infections as frequently or as effectively. So make sure you're not smoking, you're drinking plenty of water, you're washing your hands, and you're getting enough rest. Okay, so that was number 4. Number 1 was the common cold. Number 2 was asthma. Number 3 was laryngitis. Number 4 was bronchitis. Number 5, pneumonia. So pneumonia can happen in adults and in children, and pneumonia is a disease caused by an infection in which both lungs are infected. So when your lungs have an infection, they cannot expand and contract as effectively, which means less oxygen for you, which makes you very tired, and it makes your body makes it difficult for your body to fight off this infection. So one of the ways you can prevent pneumonia is they have a pneumonia vaccination. That's a fancy word for shot. So you can get your pneumonia vaccination when you're old enough. You can also wash your hands, and then also don't smoke and avoid secondhand smoke. So that's one way to prevent pneumonia, or some ways you can help prevent pneumonia. So number 1 was the common cold. Number 2 was asthma. Number 3 was laryngitis. Number 4 was bronchitis. Number 5 is pneumonia. Brings us to number 6. Now, number 6 is called emphysema, or you'll often hear it referred to as COPD, okay? Chronic obstruction pulmonary disease, okay? So this is a disease in which the alveoli, the tiny sacs in the lungs, become enlarged, making breathing hard. Now, they become enlarged because oftentimes emphysema is related to smoking cigarettes. It is generally caused through cigarette smoke or secondhand smoke. So the first thing you can do is don't smoke and avoid secondhand smoke to prevent it. And then, where possible, avoid pollution or other airborne irritants. Okay, so emphysema and COPD can be prevented as long as you don't smoke. Okay, so number 1 was the common cold. Number 2 was asthma. Number 3 was laryngitis. Number 4 was bronchitis. Number 5 was pneumonia. The 6th condition is emphysema or COPD. And our last condition is lung cancer. We talked about this a little bit in lesson 5, that cigarette smoke causes angry cells, and angry cells grow cancer, right? And then they get so strong that they don't allow healthy cells to build up. So lung cancer is the final medical condition. It's a disease caused by smoking where cells divide uncontrollably, causing tumors in the lungs. And once those tumors are in there, it's very difficult to breathe because, again, those tumors weigh on the lungs and they prevent them from expanding and contracting. The number 1 prevention of lung cancer is don't start smoking. Never smoke. Number 2, if you are a smoker, stop now, okay? Because it can help you stop the cancer cells from starting if you don't feed them the cigarette smoke. You need to avoid secondhand smoke. And then, like we talked about in lesson 5, daily exercise can also help prevent lung cancer. So recapping, the 7 conditions are: number 1 is a common cold. Number 2 is asthma. Number 3 is laryngitis. Number 4 is bronchitis. Number 5 is pneumonia. Number 6 is emphysema or COPD. And number 7 is lung cancer. So a takeaway for this, there are 4 things you can do to prevent respiratory sickness. Number 1, wash your hands. Number 2, avoid smoking and secondhand smoke. Number 3, go to the doctor and get regular checkups. And number 4, limit your exposure to pollution and irritants. So friends, you have 1 or 2 questions at the end that you need to answer. One of them is going to have you define the respiratory illness based on inflammation of the nasal passages, which we covered at the very beginning. Have fun. Make sure you follow all your teacher's instructions. It was lovely being with you. Stay well, friends. I'll see you soon. Bye.